Hello everyone, I'm Dr. Darsh Shah.
And I'm Dr. Altamash Raja.
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare.
Our guest today is Dr. Serene Shereef. Dr. Shereef is a trauma acute care surgeon, mom to 3 children, and a transformational life coach who helps women physicians struggling with burnout and overwhelmed to create their life by design. I love chatting with Serene because she has a unique framework which combines the energy of mindfulness and self-compassion. She does this by staying true to the scientific principles of habit building, time design, and individualizing systems of productivity so one can do less, live more, and create their dream life. For her medical training, Dr. Shereef graduated from the Penn State College of Medicine in Hershey, PA, and went on to complete her residency training there as well. In this episode, we discuss 2 topics that to many of us seem to be at odds with each other. And those 2 are mindfulness and productivity. I have to admit that for quite some time, I've been guilty of seeing these as 2 distinct systems, if you will. Lately, my viewpoint on this has developed though, and although conceptually my thinking on this has changed, the application remains quite challenging nonetheless. Luckily, Serene offers us some strategies to help navigate through this skill acquisition period. So without further delay, let's get right to it. Please enjoy our discussion with Dr. Serene Shereef.
All right, Dr. Serene Shereef, thank you so much for coming on to the Medicine Redefined podcast. How are you doing?
I'm doing great. Thank you so much for having me.
Yeah, absolutely. So I'm really excited to talk about this, mindfulness, productivity, things that I'm constantly thinking about on a daily basis. And Altamash and I have touched on this. It's been an underlying theme, I'd like to say, throughout all the podcast episodes that we've talked about. So I really want to start with this question. Usually we start with asking about who you are and things, but I want to delve into it. What is something that 99% of people would not agree with you in regards to mindfulness, productivity that you hold true?
Well, what I've experienced is that most people think they're 2 separate things. And I found that people really want to focus on having more mindfulness in their lives or, doing activities more towards that versus, okay, now like a separate container of thought, how can I increase my productivity? But I feel like they're both so intricately linked. I have really been a huge productivity nut for a long time. And I think it's just, from everything else going on in my life, I felt like it was a foundational aspect of my life. But it wasn't really until I incorporated mindfulness that I saw a huge boost in my productivity and really change how I'm able to do things in a way that I never was able to before. So I think it's very synergistic, and together they're definitely way more than how each of them are independently.
Yeah, absolutely. Right. I think, especially being in the medical field, all 3 of us probably have our workflow somewhat down, right? In terms of efficiency, productivity wise. That's the only way you can kind of make it through, right? Is to have some sort of system. But to incorporate the mindfulness aspect of it, right? And to delve deep into it, I think takes something, some sort of event, some sort of situation, some sort of event in your mind, like a meditation where it says, I've now thought about this a little bit deeper. And actually, mindfulness is a huge, huge part of my workflow. How did you become so interested in mindfulness?
Well, it was really because of, a variety of events in my own life. I was going through burnout and I felt like I had hit the edge of my productivity. I was already working maximum hours that I could. I had borrowed from my sleep and my rest and my personal time as much as I could. And I found that I was doing the best that I could. And yet the needs in my life were just beyond what I could really kind of pull together. So, for example, this is probably something that a lot of young physicians, especially as they're starting out, building their practice, and even, mid-career, et cetera, we're all facing this because when we're at work, we're kind of thinking, we've got the sick baby at home, or, maybe something's going on with your parents, or something is, you're really excited and planning something with your friends. And yet, how many times have we had to put aside our plans or things in our life, or even not be able to make it to the things that we want to because of work? And so I find that, what a lot of people really even share with me is when they're at work, they're just trying to not think about home, but they can't get their thoughts, right? So, you're trying to finish charts and your mind is like spinning, thinking, oh, I got to go home and I got to do this and I got to do that. But then when you're at home, you think about, okay, I need to get through dinner so I can go finish my charts and I can, put those orders in. Oh, I don't want to forget about this. So this is really how I came to mindfulness, is because I felt like my mind was just racing, thinking about all the things that I had to do. And, you hit a point and you go, this is crazy. Like, this is not productive in any way. And how can I improve my efficiency by actually maybe doing less? How can I dial some things back and be intentional in where I put my focus and my energy? And so I've done meditation and yoga even, in my younger years through my teens and early 20s. And it was really just when I started medical school that I stopped having the time to do it. Now thinking back, I wish I had continued, because it probably would have, helped me become more mindful and present in my patient interactions and all of the things that I was doing before. So yeah, so I think that's really how I came to it. I was looking for something to help me slow things down so that I could really be intentional. And it was amazing when I started to do it. What I noticed was, even, now I find even patient interactions that I used to find annoying, or I'm like, I just wish it would just be over. I realized, wow, there's so much in here. There's so much slowing time down, like when I finish a case, for instance, or, when something goes well, we never take time to be mindful and celebrate the good things. We only think about, oh, this is all the things that I didn't do right today, right? Or when you're with someone, how can we be present? So yeah, maybe you're not with them like 24/7, but the time that you're with them, it could be even more meaningful. So that's really how I started using it. And then I just feel like it's really strengthened every aspect of my life.
You mentioned how most people seem to think that those are two opposing things, right? Mindful and productivity. And I have to be honest, I think I've been in that camp for a long time. And only until very recently I've started looking at them as maybe one of the same, or at least linked. Mm-hmm. And I think it's a natural thing, particularly for high functioning professionals, right? We're all in the medical field, and it's all about putting your head down, getting through one hurdle to another, right? Your medical school, first year, second year, third year, fourth year, residency, fellowship, et cetera, et cetera. And it's all about checking the boxes. And you've alluded to some of those boxes. And if you're not checking out the boxes, you're not being productive. You're not looking forward mm-hmm. to the future, the next task, and then the next task. And the misconception often with mindfulness is that you're sitting there, legs crossed, saying some type of mantra, or just box breathing, some version of, again, people confuse mindfulness and meditation often, and we've talked about that at length before. And so, people see that and they're like, well, that can't possibly be the same thing. You alluded to the fact that you realized a couple of years ago, hey, there is a connection. This is linked in. I need to appreciate that. And so say a little bit more about how exactly they're linked, and how have you continued cultivating that skill where moment to moment you're able to string together to stay true to being mindful, but also not, quote unquote, compromising the productivity of getting things done?
Yeah, absolutely. And it's so true. It is the image that people often share with me. Well, I don't have time to sit down and meditate for an hour, or I don't have time to do, whatever their version of mindfulness might be. And what I would challenge is that, or really invite anyone listening to think, what would it be like if you actually were able to be 100% present in every moment of your life? How many times, maybe while you're driving, maybe while you're talking to someone or listening to someone, maybe while you're even, taking a history and physical, right? Like, how many times do we tune out? Do we our brain just sort of like goes somewhere else, our mind wanders. And the reality is that, especially with all of the distractions and the clutter in the world right now, in our brain, in our work, in our life, our minds are so like, I mean, I'm sure everybody, feels at some time or another like they have ADHD. Like their mind is just full of so many things, and it's hard to focus. It's hard to really put all of our energy in one place because we're doing a little bit of this and a little bit of that. The multitasking has hurt us in many ways because that's our habit now. That's how we do things. So I would bring it back to, what would it be like if just one day you were present for every single moment? Mindfulness is not just about being present. It is about having, there are different elements to mindfulness. So some of the things are, having gratitude and connection, having non-judgment. So doing something, again, having that inner voice going, well, you did that wrong. And, oh, you're going to screw this up. And, well, that person's doing something wrong, etc. Like all of that judgment, it takes us away from what is truly happening and somehow trying to figure out how do we create this alternate reality where nothing is wrong, right? That's not how life is. The other aspect is having a beginner's mind, curiosity. When we are, I remember I used to, I was faculty at one of the universities for medical students and taught first and second years. And the way they asked questions and looked at things was so amazing. And it was a time that I was feeling really burnt out and just sort of disillusioned with medicine. And I'm so grateful for that time because if it weren't seeing that and seeing the magic in medicine again, I don't know that I would have gone back to practice. I'd have been like, oh no, it's done. Because we lose that. We lose that during residency. We lose that maybe in practice. And we get so busy with doing the things that we forget what brought us to medicine. And each of us, I know we have a different story, but still there was a curiosity. There was an interest. There was a, that interest in seeing what is the next step. And I think that's what mindfulness truly brings. So no, you do not need an hour and you don't even need to sit down and meditate. Mindfulness is just bringing awareness without any judgment to the moment you're in with an open mind, trusting yourself, not saying, oh, well, I probably got it wrong or, somehow there's a problem. There's no problem. But if you open your mind, what would that be like? So I used to tease one of the things that I don't really enjoy doing is laundry. And so I started figuring out, well, how could I do like mindful laundry? What would that look like? And I played with it a little bit. That's part of mindfulness is opening up that creativity and playfulness within us to say, how could this be fun? Even something you don't like to do. Mindful cooking, mindful walking, mindful eating. We know that mindful eating actually can help with emotional eating, overeating, etc. Being aware of what we're eating and building satiety and connection. So it's not just this mindless, like, you just eat and you don't even know how the plate's empty, right? Being fully aware of your hunger and when you are full. So I think that you can incorporate that into really any part of your life and have fun with it.
Yeah, absolutely. So, you mentioned how we kind of lose that spark of curiosity as we become residents, attendings onwards. And I mean, I think it's almost safe to say like 80% of maybe even more, 90% of what I do right now as a resident in the present moment is something that I wish I wasn't doing. You know what I mean? Like, I already know kind of what I want to do in the future in somewhat, and I know we're going to be talking about not looking at the path, but if we're talking about solutions, right, if we're talking about how to stay in the moment, I mean, I can give you the example today. I had a patient, 30-minute visit. The patient afterwards is already there in the clinic. So in my mind, I'm thinking, okay, how do I make this efficient, right? How do I become productive here? Mm-hmm. But at the same time, I'm asking questions, and this patient is tangential, talking about other things. Mm-hmm. What kind of solutions do you have in mind? How do we increase the mindfulness within medicine itself, especially when so much of what we do is, boredom or not where we want to be in the moment?
Mm-hmm. Yeah. Well, the reality is actually that's how it is everywhere. Again, not to connect it back to laundry, but really everything about life is about laundry, right? How much you have to get done. So it's really just an analogy, but there are going to be things in medicine, in life, that we don't want to do. It's the the tedious part, and connecting the tediousness to something that you want to do is going to be a lot more effective than when you go down the pathway of, oh, I don't want to do this. Oh my goodness, this patient is talking so much. They're driving me nuts. Like, what's going on? That type of sort of thoughts in our mind, because then we are totally not paying attention to this patient and we're not serving them and we're not really serving ourselves. So I have found just bringing myself back to when I do things, especially a lot of the documentation part, the clicking the buttons. And I think, oh, why do I have to do this? This is terrible. And then I waste time really sort of perseverating over that. I instead think about how what I'm doing is helping somebody. It may not be me, but maybe it's going to help the person who comes after me, who's going to read the note and figure out what to do with that patient. Maybe it is the billing and coding person in my office who will find it helpful so they can do their job. Everything that we do, whether it is something small and tedious versus what we think is, oh, this is the most important thing that we could do, all of the steps, each part of it makes a difference. And sometimes I come across things and I'm like, I really do not see how this is helpful to anybody. Then for me, that's a place where I think, well, then why am I doing it again? Why do I continue to do it? And are there ways that I can either automate it? So, for instance, if you look at charting, it's just, if there's like a line that always has to go, then I just make a smart phrase out of it, right? Or if, so you can automate things, you can delegate things. Can someone else do that for you? Or if both of those aren't possible and you have determined that it has no value, then it needs to come off of your to-do list or your, calendar. So those are ways we can do it. And I think all of us have challenges with both time in clinic, in seeing patients, as well as the charting aspect. And one of the things that I have found also is just looking at what is enough. Right? Because a lot of us are perfectionists and we want to do the best at everything. And so, and sometimes, that is what keeps me like in there and doing things. And I'm like, well, what if this was enough? Like, do I have enough to take care of the patient and be done so that I can keep going? And how can I really focus on that patient and communicate that and say, okay, I want to make sure that I address your important point. Does this sound like, that's it? And then you're done.
Yeah, so I can tell, you've really delved into this, right? And I think starting with mindfulness will begin that thought process in terms of how do I make a flow chart for myself, right? Is kind of what you're talking about. One, how do I make this process larger than just myself, right? How do I create value that's larger than myself? Two, is it even worth doing in the first place, or do I need to reconsider something else? And then three, how do I just make the process even more efficient? And you may have come across this book by Ronald Epstein called Attending. So I read it during my intern year. And his whole thing is about doing the work in the beginning is going to be hard, but the more time you spend on doing the hard things in the beginning, it makes it so much easier down the road. And that's one of the few concepts that I've taken away, at least from mindfulness and productivity, that I've still incorporated. But it's tough. It's tough to kind of keep that at the forefront of your mind with every patient encounter, with every click of the button on Epic, right? But I really like how you delved into those three kind of approaches in a way.
Yeah, and when you think about automating, so, I was talking about doing a dot phrase on charting, but when you look at the basics of it, it's really habits. So we all have habitual patterns of thoughts, feelings, and actions. And repeated actions are essentially, what we all call habits, but really habits starts from our thoughts. And being aware of what is the thought behind whatever it is that you want to change. So when you want to automate something, anything in your life, from laundry to dishes to electronic medical records, to how you run your clinic, how you may finish rounds, whatever it is. It all comes down to how do you do it habitually, and then you build a system, and then you keep tweaking it until you get it kind of where you want it to be. And we call that the golden spot. But really, in life, the golden spot keeps changing because life keeps changing, right? Things change. The way we practice changes, and we get older, and so we also change. So yeah, something to, I think, when people are looking at, how do they make their day a little easier, I find habits are the way to go.
I want to talk more about this circumstances, thought, feeling, behavior loop stuff that you've talked about on your podcast quite a bit. But before I do that, I want to go back to something you said, because I've been thinking about it. You mentioned, or you asked, what would it be like if you paid attention to everything basically throughout the day? And to be honest, my initial thought, my reaction was exhausting. Mm-hmm. I mean, there are some things that have to be automatic, right? I mean, I shouldn't have to think about the route that I take to work for the last year straight, right? If you have to pay attention to every little detail there, or if you have to do tedious tasks like you're talking about when you're doing laundry, what is the disadvantage of listening to audiobook at that time and not being mindful of the turns that you're making, right? Or not being mindful of the perfect fold on the pants that we're doing and stuff, right? I mean, so to me, those two things they're kind of at odds with each other. So help me work through that. How should I think about that?
Sure. Well, I'm not going to tell you how you should think about it, but I'm going to offer a few things to consider. And I think that not everything's going to resonate for everyone. So totally, when you do things, and if it feels like, that's not really where you are, I think that's awesome to have that self-awareness. And actually, that's part of mindfulness, is doing something and saying, I don't really like this. I don't want to do it this way. And I think that's great. So the invitation I have for you is, what if you weren't thinking about the route, right? Like, nobody wants to look at the same thing over and over or think about that same pathway over and over. Our brain loves efficiency. So when you have done something multiple times, it will automatically, without even you telling it to, it will just, kind of take that part over, saying, okay, I got this part down. But what if you paid attention to, when you're driving, like maybe for a long time you weren't really paying attention. Now you're going to look up and you're going to see the sun setting as you drive home. Or you might see, someone next to you in the car and they're doing something funny, engaging with your environment in a way that you have not before. So, and I'm a huge believer in podcasts, audiobooks, all of that. And I totally use the time to listen to other things as well. So I don't think we have to do it the same way every time. But what I invite is for everyone to just think, if I'm being present in this moment, how can I create meaning and value? So meaning and value is so unique, right? I mean, it's what is meaningful to you is going to be different for me. So when you are driving, I want you to, maybe for the next week, I want you to try something different every day. And you could do an audiobook one day. You could try different audiobooks, see if there's a difference between listening to something funny versus something serious. You could listen to music. And maybe one day you're just going to kind of look around, There's a meme about someone's like, there's this person at the coffee shop and he's just looking around and smiling like what a weirdo. I mean, people used to do that, right? Not be on their phone or not be on any electronic device, but actually look up and see things around them. And, so I think that there's a lot to be said for just looking around us to see what is going on out there. I recently, when I was driving, the person next to me in the car kept pointing to my car. And I was like, what is he doing? I'm not sure why he's pointing to my car. Maybe the door is open or something. So I pull over, I'm checking, the doors are fine. And I didn't know what it was. But it turns out that I had one of my tires it wasn't even that obvious to me, but it had lost a little bit of air. And so long story short, I get it checked out and there was a nail there, and and it was slowly losing air, and, it would eventually probably have gotten into trouble. But I found it in a place where there was a repair shop right next door. And I was so grateful to the stranger who was paying attention. And I would never have known otherwise, not just paying attention, but he, like literally was trying to signal someone he doesn't know me, right? So I think that when you look around with no expectation, but just thinking, I wonder what else is going on out there. Sometimes, what you might engage and interact with might be different. And I would say maybe about 50 to 60% of the time when I go for walks, etc., I still listen to things, right? I enjoy that. And I find meaning and value in what I do. But sometimes I don't. And I just listen to, what the birds sound like, or maybe I'll take a different route. And I just look at what the environment is like, because we want our brain to learn how to recognize these different patterns of creating awareness and creating thought. It is not something that, is going to come naturally. When you first do it, the first thought that most people have, I had, was, it's kind of boring. I mean, it's not as interesting as that book that I was listening to, right? Because life has slowed down and we're not used to that. Boredom is the first step to creativity. If we aren't bored, then, we are not, our brain isn't pushed to think, to innovate, to create something new that you might never have thought about. And some of my best daydreams and vision, like envisioning what else could change, actually came from these moments of boredom where I was walking and I'm just like, okay, I don't want to listen to these birds anymore. Okay, I need to think about something, like what can I explore? And that's kind of how it happened. So my kids, they know when they tell me that they're bored, I'm like, that's great. That's the best thing I could have heard all day.
Well, I appreciate that. And I'll certainly increase the time or the percentage of my time that I spend, driving or just being more mindful. But, one of the words I used previously was being non-judgmental. And I think that stands out to me because, again, if you don't practice this art of just paying attention to every little detail, the art of not reacting and not being judgmental to why am I wasting time, that you're never going to develop that. So I think from that standpoint, I do get it. And you work closely with patients now, right? You've got a coaching practice, and we'll call this an attention audit. How frequently do you recommend this to your clients that they do this? Is it a weekly basis, once a week or, once a month, or just really whenever you feel like it or whenever you remember? Do you set a reminder? Is there some structure to it, or is it just whenever it comes to your mind?
I want to make sure that I understand the question correctly. Are you asking how often I recommend raising awareness, checking in about the essentially the judgment part of?
Yeah, I think
our self-criticism.
We all get stuck in the rat race, right? So we're talking about high functioning professionals, and I know you work with a lot of those, right? And so it's very easy to fall in the trap of just thinking about the next thing, right? And one of the things that we've been talking about for the last couple of minutes is taking a step back and not thinking about the 3 steps ahead, right? Just focusing on this one and maybe just the next one, maybe. And so I imagine that maybe when you're in my seat, there's it's a skill that you have to develop over time. It's not easy to do, right? Your brain will revert to something you've learned for 10, 15 years. Mm-hmm. Medical training is, depending on what you do, anywhere from 8 or 7 to 10 years. And so relearning that in the beginning is going to be very, very challenging. So when you advise that and you're unlearning these behaviors, or your clients are, how do you advise them to do this checking in period?
Honestly, every day. and it's something that I practice daily, because this is something that we have already learned to do. I mean, the opposite of what I'm recommending, right? Like, we have learned that every day for years and years. Even for a lot of us, it is from undergrad onwards, trying to be getting all of the corners, crisp and getting everything right. And so criticism, and I mean that, it sounds negative when I say it that way, but being able to guide ourselves by checking, what are we doing wrong? How can we do better? Is, I think, a question that we have asked ourselves for a long time. And the goal always was to continue to be better. But what I found is that my brain could only go to what's wrong. When I first started this practice of really the opposite of judgment is self-compassion. So self-compassion work is a huge part of what I coach on and what I share, because I honestly had no self-compassion when I first started, because I felt like, okay, like these are all the things I'm doing wrong, and then I just need to suck it up, buttercup, and get it done, right? I mean, there's no reason to sit here and feel sorry for yourself, because that's not going to get anything done. And so these are the kinds of thoughts and habitual patterns that showed up in my life, and that I hear from a lot of others as well. It is, if you think about our M&M process, our morbidity and mortality conferences, and how we look at each of these cases. Now, I don't know about, everyone, but in my training, without naming any names, it was very, very, it felt like there was a lot of blaming, shaming, and guilt involved. And I felt like I lost the part where I'm supposed to be learning. So when we look at something that has gone wrong, right? And of course, there are going to be things that go right, and then there are going to be things that go wrong. And we need to have awareness as clinicians to be able to do an assessment, an honest assessment about what are the things that didn't go right here, and how can we make this better? That is learning. When we bring in blame, shame, guilt, this person did this wrong, that person did that wrong, and this is why all the things went wrong, as humans, we get defensive. And then our thoughts are either, oh my God, that's terrible, I've done this terrible thing, and now and then it's like doomsday, terrible things are going to happen to me, and I'm never going to be better. I'm never going to, practice in this area, or whatever it might be. But the reality is that, my mentor once told me, everyone who practiced medicine, he was talking about surgery, everyone who operates, they're going to have complications, because that is part of medicine. But then we create this terribleness, this, again, like shame, blame, and guilt is connected to every complication that happens. Where is the learning? Where is the role modeling to our juniors? This is how we take ownership of our mistakes. This is how we talk to families. This is how we own up and we make things right. I feel like that's not really discussed. And that can only happen when we let go of defensiveness, when we're open to talking about what we feel, what we struggle with, because the reality is, honestly, everybody's struggling with this. But no one wants to talk about it because they don't want to seem like, they're not quite all that great. Well, you know what? We all make mistakes and we all learn from it. So I think that's, for me, that's why it's so important, especially when we are, doing something that is, that has that life and death implications in the decisions that we make, in the recommendations that we tell our patients, in the procedures and, processes that we follow through. So if we don't practice actively everyday self-compassion, then we're going to go down this rabbit hole, and then we're stuck back in that burnout path where we feel like, things are terrible and it's never going to get better.
So let's go back to this thought, feeling, behavior loop, right? And well, I guess it's all preceded by circumstances, as you've said before. So maybe if you could explain to the learners this framework that you have, and then we can talk about some interventions of, how we can break that loop and maybe reframe it positively.
Sure. Yeah. I this is really just sort of basic psychology, but a lot of people have taken this idea, and they have really explained it in a beautiful way. So I'm going to use the model. It is the self-coaching model from the Life Coach School, which is where I did my coach training. And you're going to see this. I mean, there's so many authors who've written exactly this model. And I did undergrad psychology, and I remembered this from, undergrad psychology. So what I'm going to share is really not anything like new that no one's ever heard before. But even though I'd heard it in undergrad, even though I'd read books on it, it never really, the simplicity of what I'm going to say, I never realized how transformational it is. So circumstances are facts. They're just things that are in our environment. So people, things that happen, words people say, whatever it is. These are just things that if I looked at it and you looked at it, we would both agree, okay, that is a fact. In a court of law, we could prove that, so-and-so really did say this, right? And then we have no control over circumstances. But everything else I'm going to share now, we have absolute control over. And when I say that, I want to put a caveat to it. Half of actually probably more. And this is where mindfulness, by the way, comes into play, and self-awareness. We have our conscious and our subconscious, unconscious space. Okay? We are only aware of, and therefore can only change, things that are within our consciousness. If we don't know it exists, even if it's deep in our mind, we can't change it, right? So the more mindful you are, the more connected you are to your own thoughts, to your, self-awareness on what is happening. Why are these things coming up? Why is this a trigger for me, etc. We're not going to be able to change that. So each of us, we experience this world through our thoughts. Now, what I mean by that is, say there's a chair. I sit on this chair being the circumstance, and my thought is, this is amazing. This is the coolest chair ever. I like it. And that thought triggers a feeling of maybe wonder or excitement that I found this cool chair. And my action that is directly connected to my thought and my feeling is I sit on the chair, maybe I don't want to give up the chair to someone else, right? Like I'm like hogging that chair. And the result is, which is always a reflection of our thought, is that this chair is amazing. Like I am enjoying and finding wonder in that chair. Now you come sit on the chair and you're like, this chair is so uncomfortable. I do not like this chair, right? I mean, we've all had that. We look at the same thing, we experience the same thing, and we think one person experiences it differently than another. And it's just through our thoughts. Our thoughts are really, again, how we experience the world. And it generates the feelings, then actions, and ultimately our results. Repeated actions become our habits. So repeated thoughts become our beliefs, the stories that we tell ourselves, what sometimes people call mindset, etc. It's just, this is stuff we repeat to ourselves. So when we are aware of a thought that causes pain, that maybe is causing problems in our life, we call that a thought that doesn't really serve us. It's not really making our life any better. Then we have the choice to say, well, I don't have to think that. I could think something else. Now, it's not going to be easy to go from this thought that you've thought for a long time, you're kind of attached to it, to creating something new. And that's, again, where repetition, awareness, self-compassion, all of that comes into play. And we can really slowly shift. And it's really as simple as that, but so much more complicated, because it takes a lot to build that awareness and then be able to create that shift.
So, with your clients, when you're talking about getting to this level of awareness, right, we're living in a dopamine crazed world right now, where our mindsets, our thoughts are really lasting 5 seconds, right? And I think, I've gotten to the point of what you're talking about, but a lot of it took meditation. It took sitting with my thoughts and being uncomfortable with them, as if it's I think of meditation as my email inbox, and things are flooding, you're sifting through it, you delete, but as you're deleting, more things are coming in. And the goal is eventually, kind of look at it, get to an inbox of 0, but that's going to take a long time because you're starting with an inbox of 1,000 with human nature. Is that kind of what you're recommending to your clients, is to be able to sit down with their thoughts? What's your approach with that?
Yeah. And first of all, something to even ease that feeling of, oh my God, I've got like 10,000 emails or 10,000 thoughts, which, by the way, we have about 60,000 thoughts a day. So, and the majority of them are subconscious. In fact, a lot of thoughts
Okay.
that cause pain, fear, anger, frustration, all of these negative feelings, a lot of those thoughts tend to be subconscious. We don't want to be aware of them, right? Because they cause pain. So, I offer to my clients that the goal isn't to get to an inbox of 0, because life is going to continue to happen. The goal is really to learn how to create a pause when you experience something that generates emotions that you're not quite sure how to deal with. So a lot of us, we experience something, we have a thought about it, and we react. We're in a reactive mode. And, when you think back to all of the times in the past where you've maybe reacted and you haven't taken the time to think about it, some of those aren't really great experiences, right? But when you create a pause and you think, okay, this has happened and it is now generating an emotion within me that I'm not, I don't feel comfortable with. Maybe it is fear, maybe it is pain, maybe it is discomfort. How can I allow that feeling? How can I understand the thought that is coming from it, right? The thought that is triggering it. And how do I want to intentionally, consciously respond to it? And that is a learned skill. So that is the ultimate, yes, we want to get to a place where no matter how crazy it gets, right? Like the kids are going nuts and dinner's not ready and, everybody's crying and, our patients are upset and, our boss is like saying things to us that we're like, why are you saying this, right? So when all of those things happen, how can we find peace and calmness and contentment just where we are? And that is, I'm still working on that. But backing up for a second, what I really have my clients do is I ask them, what are the things that are coming up for you? What do you want to work on? And that's really kind of how we start. So I have a framework that I take them through. And my goal is to help them go from where they are, where things feel difficult and uncertain, to getting to a place where they feel like they're really living their dream life. So they get to design and create what they want it to look like. We do some visualizations and guided meditations and things like that, as well as a lot of journaling. I give them journal idea prompts, and these are the things that, based on what they're struggling with, etc. These are the things that I want them to think about, and then just free journal whatever is coming up. And I have found that when you combine meditation, and it could be really short, like 5 to 10 minutes. You do not need to meditate for an hour to truly get those benefits. But you need to learn to let your mind be where it is and just open up, go through any type of meditation process, that they want to. And then that is when you're the most connected to your, the thoughts that are not accessible. So this would be your subconscious. It takes a little bit more work to get your unconscious. That's like, technically they call it like the space that we can't access, right? But it is accessible. All of this is accessible to us. So you meditate and then you journal right after. And I have found that with that, it really opens up a deeper level of connection and awareness. And so when you journal from that space, you're accessing information that you may never have been aware of before.
Yeah, I like that, right? And I think throughout you talking about that, you said the word learned, right? And this is a learned skill. Mm-hmm. And I think it's so easy for people who have, I don't even want to say mastered mindfulness, but who are pretty comfortable with it, to say, oh, this is what you do. And this is all I do. And I've said that many times to many people. It's like, oh, I just meditate for 15 minutes. I journal, I do this. And then people will try it, but they say, whoa, like, no way I'm doing that. And the thing, again, it's a learned skill. This thing takes time. It takes practice every single day. It's an up and down journey, but over time you're going to look back 2-3 months and say, whoa, like, look how far I came, and I'm seeing things that otherwise I wouldn't have before. I want to transition now to something you've mentioned in another podcast where you say we need to stop looking at the path forward. And we know it's human nature to look at the future, have some sort of anxiety, and try to understand where their life is going to unravel and kind of have a path. And I love this concept because a year and a half ago, I did a TEDx talk, and it was about how our truth is ever evolving. And I think it kind of hits the same notion, at least from my perspective. It's about how we have all these truths and it's written in stone, and we think all those stones are going to line up perfectly for us, but the next thing you know, a stone is turned over and you now have to take a different path. And so it's okay to be comfortable with understanding that this truth, everyone's truth that we're always seeking but will never find, is going to change. So I just want to hear from your perspective what exactly you mean by, we need to stop looking at the past.
Sure. So it's interesting. If anyone had told me like 10 years ago that this is what I would be doing and this is where I would be like, I don't know what you're talking about. Like, that's totally crazy, right? This is not what I ever expected to do. Now, I used to be one of those people. I wanted to know what was going to happen for the next 20 years, like planned out. This is like, this year I'm going to do this, and next year I'm going to do whatever. So, and I still like to plan. I'm a planner, and that's just who I am. But I guess now I'm a planner that literally, like, I have an overall vision of what I want my life to be, but I don't worry about what is going to happen. So
100%.
Right? So, because you know what? The reality is that we just don't know. And it opens up a space. It opens up a space that, you get to explore, you get to play with it a little bit, because the old version would be like, well, I mean, if I need to get there, then I need to stay focused and I can't get distracted and I got to do this, and this. And, you're going down this pathway, and you're right. Like, things come up, and then, like, where are you really going to find that energy or, that focus to pivot, because you've got all of your eggs invested in this path. But if you allow yourself to just be and do one step, then what I found is that every action builds more clarity. When I do different things is when I realize, wow, like, this is amazing. And I never would have known that if I hadn't kept an open mind. So I think it's when we try to think 10 steps ahead and we're living in that space instead of now, then, well, first of all, we're not being mindful to the present moment, but also
Right.
We are, I think, missing a little bit of the magic of discovery.
Yeah. Yeah. I've also seen, I think, more opportunities open up to you when you yourself are open, right? Like, after residency, I don't know where I'm moving to. I'm open. Yes, I have a vision. Yes, I know exactly kind of the things I want to do, but I don't know the people I'm going to meet. I don't know what tomorrow brings or in 2 months. And I think there's so much excitement and wonder to that I've really, truly learned to appreciate. I mean, before, I could tell you as a pre-med, it was like, nope, I'm in a 7-year med program and I'm going to this and I'm going to that. And none of that happened. And looking back, it was like, wow, that was actually the best thing that's ever happened to me. And so through those process and quote unquote failures, I've learned to really just appreciate the journey, right? And I think it's just such an exciting time when you can when you can truly enjoy it and not really worry.
Right. And I just want to highlight something that you said that I think is beautiful, and something that I think it is a skill to be learned, which is just having belief in yourself, right? No matter where you go, you got your back. You can figure it out. It's going to be just fine. We think that life will only be okay if we follow the path. And when we get off the path, then like somehow life is like, it's over. I've heard this from so many, like, oh, I didn't get that promotion. I didn't, I didn't get accepted for that job. Like, it was my dream job and now it's over. Well, what if there's another dream job? What if there's something even better out there for you? But when you close your mind, when, you're off the path, then it's harder for you to see what is out there. And actually, when you open your mind and look at, okay, what else could be available? So, this didn't work out. I mean, it's totally great to have visions, and I do that too. I love to plan. But when things don't work out, it's okay to say, I wonder why this didn't work out. What else could be out there for me? What am I missing? And asking yourself questions is actually a great way to explore curiosity, because when you ask anything in terms of a question, it actually makes your brain go, oh, yeah, I wonder, what could be, as opposed to saying, well, this is just the way it is. And then, then you're kind of like putting a period, closing the door on anything else that may come up. So believe in yourself. All the things, right, that we have done to get here, we'll figure out the next step, whatever it is. And we don't have to know all of it.
Speaking of skills, I want to ask you about conquering time. And I think I'm going to take the long way there. We've talked a lot about, or you mentioned that our brain has the need for creating more efficient systems. And I think, again, I keep going back to high functioning professionals, at least I speak for myself, that's essentially 2x, if not 10x, right? Mm-hmm. Constantly trying to consume knowledge, trying to apply that as well. And so I often, whether I'm listening to podcasts, following people on social media, whatever it might be, I'm looking for systems to make workflow productivity more efficient. I think about a recent podcast I listened to, All the Hacks by Chris Hutchinson, awesome podcast. And he had a recent guest talking about the apps that basically, again, make systems more efficient, right? Whether it's Instapaper, Readwise, Superhuman as an email workflow to make more efficient so you can, save time everywhere possible. And so that was amazing. And all of a sudden I'm downloading all these things onto my phone and my Chrome extensions. And then on the flip side of it, I listen to your podcast. I'm reading a current book by Oliver Burkeman. It's called 4,000 Weeks. And I picked it up because the subtitle said Time Management for Mortals. And I said, yes, this is what I need. It's going to give me the answers. I'm not through it all, but I've been pleasantly surprised about 3/4 of the way in, because essentially what the author's talking about, well, the fact of the matter is you can't conquer time, right? And he highlights several different ways to approach it. But one of the things he talks about, listen, you'll create a list of 20 of the most important things to do. And you'll get through the first 5, and then you'll put a category B for the next 5. And the fact of the matter is, when you finish the first 5, you'll have another 5 at the bottom or at the top, and you're never going to continue to finish the list. So make a list of 20, focus on the first 5, and get rid of the next 15, even though they might be just as important, right? He also talks about how this concept of, leisurely activity to be more productive, right? It is only somewhat a recent development, maybe in the 19th century, where, before people could just take vacation for the sake of taking vacation, but now you have to take vacation so you can be more refreshed to come back and work and be more productive of an employee, right? Oh, you must take the vacation so you come back. And so there are a lot of nuggets in there, but I look at these two things, this, and then the episode that I mentioned, and all these, task lists on iOS and all that kind of stuff. And there's a hard delineation for me, at least, and maybe it's because my brain isn't sophisticated enough to process them together, but I'm curious, how do you balance, or how do you reconcile those two opposing truths?
Well, when there are two truths, usually it just means that each of them may be a half truth, right? That's how I approach when someone says, well, this seems pretty valid and this seems pretty valid, like, how do we, but they're opposite of each other. How do we equalize? You're not going to. What you're going to do is take whatever has meaning and value for you. And for all of us, it's going to be different. So what I mean by that is, what I think of as productivity is going to be different for you and for, my partner, or, for all of us, where we have different ideas and visions of what we want productivity to be. Now, having said that, I am probably more on the side of the do less to achieve more camp. But I do think that any ways that we can create efficiencies, I think it's amazing, and we totally should use it. So I do use, a variety of apps and programs and ways of managing my life, both personal and professional, so that I can maximize my time. Now, time is, I'm sure you've heard this referred to before, but time is neutral. Time actually, none of us are going to conquer time, because time is like, it's just something fixed. It is a circumstance, and we all have thoughts about it. So the thoughts about time are multitude. I don't have enough time. I wish I had more time. I would do so much more if only I had more time, right? Well, no, your to-do list would probably just get longer. I don't know that you're going to finish any bigger percentage, but I wonder if we, instead of trying to like somehow figure time out and making time like the thing that we're going to like, break down and make it work, I think the thing that we really need to focus on is our focus and our energy and how we manage that. Because I don't know about you, but so many times I have sat down to do something and it will like I'll spend 3 hours and I'm just not making much progress. And then I take a break. Maybe I'll go for a walk. I'll do something else. I come back 30 minutes, it's done. So it had nothing to do with time. Yes, I spent 3.5 hours doing it, but really I spent 3 hours squandering my energy, my focus. I had no focus. And then I spent 30 minutes of intense focus and energy to get something done. And people refer to this as your deep work or creating that flow state. There's very many different ideas on creating that, time, energy, focus, like continuum, time, space, similar in concept, but different. So that's really where I try to maximize my efforts is how can I manage my energy? How can I manage my focus? If I don't have both of those managed, then there's no reason for me to sit down to work. I'm not going to get anything done. It's a waste of my time. So I'd rather do something else, with that time. So I do look at, and some days we have a natural flux of energy. There are going to be some days that you feel like super productive and focused. Use those days and get a lot done. But there are going to be some days you are just naturally going to be low energy. And I think pushing ourselves to do things that requires deep flow or focus when we are in that space is not very productive. So I have low energy and high energy tasks. And I do my low energy tasks on the days that I have low energy, because I know that these are just routine like things that I don't really need to think too much about. I can get some of those things done. The other thing that I have intentionally scheduled actually into my calendar is rest every day. And rest is that vacation time that we're talking about. And I'm a huge believer that when we create moments of rest intentionally every single day, it changes the way our creativity and our productivity is boosted. And so when I say this, most people tell me, well, I don't have time to rest every day. Like, what are you talking about? So a lot of different ways to do it. But the main thing to consider is, we all have 5 minutes. If 5 minutes is what you have, then create a restful routine for 5 minutes. Maybe you have 10 minutes, maybe you have 20 minutes, whatever it is. Don't think of it as a waste. Think of it as the magic to get your productivity back to that 10x or whatever you're looking for. So lots of ways for us to manage our focus and energy, but ultimately I think time is just a circumstance. And when we let go of the concept that we're somehow managing time, then I think we really focus on what's important.
Yeah, I like that. So a comment about time brings me back to one of my favorite passages from Meditations by Marcus Aurelius, book 2, passage 14, where he talks about how, a 2-year-old and a 90-year-old don't have a difference in terms of time and how long they live. The thing that they have in the same is that the present moment can be taken from them at any point, right? And so I think it really, talking about what we're talking about, it really brings you back to the point in time that you're in right now, right? Which is the present, and enjoying that and kind of conquering the present, if I can say. So it just kind of looped me into that mindset when we were just talking about time and all that. You talk about how people say that they don't have time to rest. And if anything that we've learned during COVID is that maybe there isn't such thing as a work-life balance, right? Maybe they're not two separate things. Maybe they are just one, and it's life. I wanted to get your thoughts on what work-life means. Is it two separate things? Is it one? How should people view that?
Yeah, I think that the illusion that we're going to have this balanced life where we get to focus on, we talk about the wheel of wellness, right? All the different aspects of our life, etc. Those are all, I think, ideally great. And of course, the theory or what we work towards is finding that balance. But in the meantime, I think integrating them and working on how do we do during different parts of our life, different seasons of life even, how can we focus on what we're doing? So for instance, how I explain to people is in a 7-day period, you're going to have some days that work is going to take priority, and there are going to be some days that life is going to take priority. Every day, every moment, you're not going to have work-life balance. You're not going to have like an equality between the different things, especially in our profession. And that's okay. But overall, in your week, maybe even a month, when you look at it, if you are only able to do one part or only pay attention to one part of your life, whether it is career, whether it is, and even if, say you're kind of taking a break from work and you're doing just, you want to like have a vacation, etc. Right? When we try to split those things, there are going to be some parts of our life that gets priority over time. But at the end of it, if we don't have all of these parts represented, what ends up happening is our self goes out of balance. So I think that the integration is really just recognizing that different seasons and different days, different weeks, if you will. Because some of us, I take call like 1 week at a time or a bunch of days together. So it might be that week, I don't really do a lot of life. I just work. And that's okay, because I know next week I'm going to do maybe more life. Or, the week after there may be, and we kind of like, it's just 2 categories, but really like the wheel of wellness, the wheel of life, like it looks at it from like 6 to 8 categories. And we want all of those parts represented because they're all part of us.
Yeah, I like that, right? The wheel, the pendulum, we were listening to a podcast, Altamash and I, about with Kelly Starrett talking about, when you become a father, sometimes, it's the fatherhood that takes over the precedent of working out and being busy at work. And then, at some point it'll swing the other way and you can take care of those things. And being aware, self-aware, and being okay with that, is part of a huge process of learning to be human. So interestingly, throughout this episode, a lot of books came to my mind that I've read. And when you talk about your journey, the whole reason I got into mindfulness and productivity was actually just by reading and learning these concepts and then really digging into it. So, some of the books that I'd like to share with the audience, at least from my end, is The One Thing from Gary Keller, The Power of Now by Eckhart Tolle, which you talk about the present moment, Deep Work by Cal Newport, Atomic Habits as well is a great one by James Clear. Are there 1 to 2 books or resources that you recommend that people should be checking out in order to gain some more knowledge in this area?
Sure. Well, now that you've said 1 to 2, that kind of limits. So I'm a huge fan of Atomic Habits as well.
2, 3.
Yeah. So it really is in categories. I'm gonna go with habits,
Okay.
which is a lot of what I help people do with as well. Is Atomic Habits and Tiny Habits by BJ Fogg and the Power of Habit, which is really more of the neuroscience, but truly understanding, how we develop our habits and all of that. So, that's by Charles Duhigg. So I think those 3 are my favorite habit books. Then really any of the work by Brené Brown. I think, Daring Greatly, Atlas the Heart, Power of Vulnerability, Gifts of Imperfection. So many of her books are amazing. And Kristen Neff did a lot of work in self-compassion. And
Right.
she also has, if you go on Audible, she has like some of her, I think it's like a seminar that she did or something, but it's amazing. It's just like a variety of different meditations. So that, is one of my favorites. And then let's see, I would say those are my favorite authors. But there are, there's really honestly so many.
Man, I don't have room anymore, but I've got to pick those up, I guess, and get started. So awesome. Well, thank you.
Yeah. Oh, one more. Positive Intelligence.
Yeah.
By Shirzad Chamine. It looks at like the way we self-sabotage and how do we build our inner wisdom. So it's amazing.
Well, Serene, I want to thank you. I think that this has been this discussion has given me a lot to think about, and I really appreciate that. I always, when I'm lack of a better word, humbled, and have to reframe or rethink about the way that I'm approaching whatever it is that I do, that I'm always excited about that. And when you were talking about how focus is more important than time, because time can be wasted, I thought about, Sam Harris talks about how time isn't the most valuable resource. That kind of reminded me of that. Our attention is, right? Because we often do things and we never think about if that's the last time we're ever going to do it for whatever reason, whether it's life or other circumstances, or that's it. That's all the time that we have on Earth. And so I want to thank you for giving us your attention and your time. This has been a lot of fun. And before we ask you the last question, please tell the listeners where they can find you, how can they connect with you, and how can they reach out if they want to work with you.
Sure, absolutely. So they can find me on any of the social medias. I'm on Facebook, and I'll share the information with you as well, so you can add it. But I'm on Facebook and Instagram. You can find me on Instagram at Serenity Wellness MD. And Dr.Serene. And I'm on YouTube podcast. My podcast is Mindfulness and Productivity Systems. And my website is serenitywellnessmd.com as well. So lots of ways to reach out. And there's a way to, talk to me or send me email, etc., connect with me through my website as well. So I think those are probably the best ways to reach me.
Awesome. So with that, the overarching theme, as you know, is adding the health back to healthcare. And so that's the question for you is, how do we do that? How do we add the health back to healthcare?
Well, I think it's really making sure that we're healthy. What we do is such a critical part of healthcare and providing care to our patients. And when we are not healthy, and I'm talking about mind, body, and soul, when we are not healthy, then we're not able to give our best. And so many, I think, people are going through burnout and either leaving medicine or, struggling with mental health. Physician suicide, as you know, is, it's unbelievable. Like, we shouldn't have to we shouldn't have to struggle with losing colleagues who are struggling with this because they're not aware, right? They don't realize that it is not them. When I was going through burnout, I felt so isolated. And again, coming back to that shame, blame, and guilt cycle is so real. Like, I felt like I was the only person struggling. Everyone else had it figured out, and there was something that I was doing wrong. And it was really just my problem. And so I think part of it is, things like this, when we talk openly about our journey and when we open the door to discussion and curiosity and engagement and sharing, being vulnerable with our journeys, even though it feels like, I don't know if I want to talk about it, but really, if we don't, then I think we're going to continue to lose our colleagues, either not wanting to practice, which is a loss to healthcare, or, even worse. So I think it is really important for each and every one of us to know that we matter and that, our health, our well-being is really important. And that is how we can give our best to healthcare. And, just to highlight something here, a lot of the reason why I decided to quit full-time medicine and kind of explore what's going on and what to do is because of death, really. People in my life and just different interactions that actually highlighted to me that life is so short. We don't know, as you mentioned, right? We don't know if we're going to experience something for the last time. And as I engaged with others who were either struggling with this, because of illness, disease, or not even like sharing that this is what they're struggling with, what I realized is that, is this really how I want to live my life? What if today is my last day? Like, how would I want to live it? What would I fill it with? And how would I create meaning and purpose and value, both for myself and for others, right? And I think that's the question we ask ourselves. It's just, what do we need to do for ourselves so we can help others? But when we are trained to think, how do we help others? And then, maybe like as an afterthought, we think about ourselves. And I think that's just backwards. So not to make it morbid, I feel like because of what we do, like death is part of what we do. So we are always aware of it. And it doesn't have to be morbid. It can help us be mindful and live each moment like it is truly precious.
Healing the healers. Put on your own oxygen mask first.
Yeah, definitely.
And memento mori. Love it.
Serene, thank you so much. It's been a pleasure.
Thank you for having me. It was great.
Thank you.
Thank you for listening to another episode of Medicine Redefined. Our hope is that there was something actionable in there for you that you can implement into your daily lives today. At the very least, maybe this changes your perspective on what productivity means in today's day and age, where we have more applications, more systems, and this idea that we have to do more and more and more. It's very challenging to reconcile that with the fact that we also have to be present. I think most people tend to appreciate that, but feel helpless when they are trying to do both things at once. I know I've been guilty of that, as I mentioned before. So at the very least, this episode can be a gentle reminder that you're not alone. Now, if you need help with that, please be sure to follow Serene at serenitywellnessmd.com. Her link tree is linked in the show notes, so you can follow her on all the social media platforms, and also check out her podcast, Mindfulness and Productivity Systems, which I found to be quite enjoyable myself. Now, before we sign off, please remember the important disclaimer that everything in this podcast is for educational purposes only. It does not constitute the practice of medicine, nor should it be construed as medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. However, if you enjoy the show, please be sure to subscribe, review, and share with anyone who you think will gain value from this, and we'll catch you next time. Thank you for listening.